Hello, everybody. My name is Tai Hin Bok. I'm gonna a little bit about myself. I've been a registered nurse for about 11 years. Today, I'm gonna present to you some information on sexually transmitted diseases. It's also called sexually transmitted infections or venereal diseases. And it is considered a silent killer in our town presently. For those at greatest risk, they are not adequately equipped with the knowledge to safeguard themselves against these health issues. So knowing about sexually transmitted diseases would not just help you with your personal health, but also contribute to the health of your community in which you live. Okay, for the route of transmission, you can get it through person-to-person contact, sexual contact, or contact with IV drug needles used by the infected person. You can get it also through childbirth or breastfeeding. Okay. Infected persons have a increased potential to infect others even without having the active disease or without the signs and symptoms. Okay. The first infection that we're going to talk about is chlamydia. Chlamydia is a bacterial infection that causes that affects the genital areas. Most commonly, it is the most commonly reported STD in the U.S. According to the CDC, or the Centers for Disease Control, there are about almost 1.5 million cases reported currently, yearly. Women are 3 times as likely to than men to have chlamydia, and African Americans are affected more so than any other races. And folks, females in their teen years and in their 20s are more likely to get it than any other age groups. Chlamydia, if not treated, you can pass it on to the newborn babies during childbirth. Signs and symptoms: you can get vaginal discharge, you can have bleeding after intercourse, you can also be asymptomatic, especially in women. The risk factors are included are those who are less than 25 years of age, people with multiple partners, or people who do not use barrier contraceptive methods, or of course sexually active individuals. Okay, the second infection that we're going to talk about is herpes. Herpes is a viral ulcerative lesion that begin as a group of blisters form, and they break to form like a larger sore, especially in your private area. Okay, they can occur on the vagina, the anus, or the pharynx. Outbreaks of herpes are generally recurrent, and they alternate with periodically with latency. So there currently are no cure for herpes. They have the signs and symptoms are ulcers that are covered by a white ulcerative layer, and sometimes you may have itching and tingling before the blister eruption. The risk factors are folks younger than 25 years of age, people with multiple partners, and of course sexually active people, and people with who do not use their contraceptives. For the third infection, we will cover gonorrhea. Gonorrhea is a bacterial infection that causes, that affect the penile area in males. In women, though, most often there is asymptomatic, meaning they have no symptoms. And if not treated, gonorrhea can cause problems with the joints and also problems with the heart valves. It is one of the most commonly reportable disease in the U.S. And in 2010, there are roughly over 300,000 cases reported. They are more prevalent among the sexually active adolescents, younger adults. They are, if not treated, they can lead to transmission of HIV infections. Okay, for the risk factors, we have those who are less than 25 years of age or younger, sexually active people who are not using barrier contraceptives, and also people with multiple partners. For preventions and treatments, we will aim at modifying the risk factors. That means that we can practice abstinence, we can limit the number of our sex partners, we can also practice condom use, okay, and also to limit the spread of STDs, we can also do routine screening on those at greatest risk, including adolescents, people with multiple partners, people who are homosexuals or prostitutes or homeless folks, or even people who have new partners within the last 3 months. And medical treatments, we can aim at male circumcision. We can have prophylactic drug therapy for pre and post exposure. We can have vaccines, or we can have vaginal and anal microbicides, or antibacterial creams and such. And then finally, sexually transmitted diseases is a social health problem, and it calls for a national effort to aim at education at all levels. We can, there have been times when people have implemented the dispensing of condoms in public places, kind of similar to a newspaper stand, only dispensing condom. And we can also use the media as mass communication for to emphasize the avoidance of spreading STDs. And really there's no single intervention that can prove 100% effectiveness, but rather we can use multiple aims or multiple ways to achieve improvement, or everyone should take responsibility for their own personal health, and anything that is effective in retarding the spread of STDs should be implemented. So now we can open up the panel for any questions or any ideas. You have 2 or 3 minutes. Okay, Gwen?
Okay, so for those who are with non-curable STDs, how do they go about living their lives?
Non-curable, that would be herpes. And I know herpes, they can use antiviral or certain drugs to control the outbreak, meaning they can limit the occurrence of the blisters occurring. And they really educate the patient to limit the sexual contact when they have an active outbreak. So they engage in sex or sexual activity only if there have no lesions present. Okay, so any other questions?
No.
No.
What are the treatment regimen? Can you name a few?
You can use, like I said, vaccines. You have vaccination for, what is that? They have a thing called a Gardasil
Yes.
shot now. You can use, they use antibiotics, but we normally treat the his and her treatment. So wherever you get it from, you bring your partner in too. That should help. So, anybody else? Anybody else?
What would you like the public, I mean people like ourselves, what would you like the family to know from us? Should there be, what you call it, treatment regimen obtained from over the counter?
Over the counter, I don't think it's strong enough to treat. The only thing that I know that's over the counter is a yeast infection, which you can use a diflucan cream or something that is suppository like that you can use for like a yeast infection. But as far as STDs, probably no over-the-counter drugs that is most effective for that. Okay, son, are you done?
Are you done?
Yeah.
It's your speech.